tuliokutanika hapa, na utujalie tuyatende na kufikiria mambo yote yatakayofikishwa mbele yetu kwa njia ya haki na uaminifu, ili utukufu na sifa zako ziendelezwe, na ili kustawisha amani, ufanisi na heri ya nchi yetu, na wale ambao haja zao umezikabidhi mikononi mwetu. Amen. Sergeant, you can ring the quorum bell.
Just at the time the House was just about to commence business, there has been notified that the House doesn't have the
Order number 1, administration of oath. Order number 2, communication from the chair. Order number 3, messages. Order number 4, petitions.
Order, Honorable Member for Sirisia, take your seat, please. Honorable members, we have a petition. Take your seat. The nearest seat. Honorable members, we have a petition regarding poor implementation of EDU Afya Medical Scheme in public secondary schools. Honorable members, Article 119 of the Constitution accords any person the right to petition Parliament to consider any matter within its authority. Further, Standing Order 2252B requires the Speaker to report to the House any petition other than that presented by a member. In this regard, honorable members, I wish to report to the House that my office is in receipt of a petition from one Ms. Joyce Cherono of National Identification Card number 2170217, calling on this House to intervene on the matter of implementation of the EDU Afya Medical Scheme for students in public secondary schools by the Minister of Education. The petitioner, practicing nurse who claims to be the brainchild behind this idea, claims that since the scheme was rolled out in 2018 to enable students in public schools to access affordable and quality health care under the National Hospital Insurance Fund NHIF cover, utility of the scheme is yet to be optimized. She associates poor implementation of the EDU Afya scheme to various challenges. First, the petitioner claims that the technicalities within enrollment by the Minister of Education of all students in the National Education Management Information System NEMIS database, from which the EDU Afya scheme obtains students' data, has resulted in low uptake of the fund. The petitioner adds that the system which runs EDU Afya patient identification and billing are often slow or non-responsive, thereby compelling parents or guardians of students under scheme to meet the cost of treatment due to system failures. The petitioner is concerned that the Minister of Education and other relevant stakeholders have not undertaken public awareness of the program in order to encourage enrollment. The petitioner further alludes that the government rolled out the scheme without putting in place adequate infrastructure and medical personnel in public schools to offer consultation and referral services. She also claims that there were no monitoring and evaluation framework in place to assess effectiveness of the program. The petitioner is afraid that if intervention is not made towards ensuring that the program is optimally implemented, the gains envisaged from the scheme will be lost. The petitioner therefore prays that the National Assembly, through its Public Petitions Committee, 1, causes the relevant ministries to urgently review the framework for implementation of the EDU Afya Medical Scheme to provide regular monitoring and evaluation that addresses challenges facing the program and ensure that students in all public secondary schools equally benefit from the EDU Afya scheme. 2, causes the government to support the establishment of clinics within public secondary schools and to initiate employment and deployment of qualified, registered, and licensed medical personnel in schools under the fund to ensure that students optimally benefit from the scheme. And 3, makes any other order that it deems fit in the circumstances of this petition. Honorable members, having determined that the matters raised by the petitioner are well within the authority of this House, I order that pursuant to the provision of Standing Order 2271, this petition be committed to the Public Petitions Committee. The committee is required to consider the petition and report its findings to the House and the petition in accordance with the Standing Order 2272. Thank you. Yes, so the Honorable Makali Mulu.
Yeah, thank you very much, Honorable Speaker. Honorable Speaker, I want to take this opportunity to thank the petitioner for raising up this petition in the House. Honorable Speaker, the petitioner raises very fundamental issues relating to that scheme, Honorable Speaker. And I think, Honorable Speaker, even as...
Sorry, Honorable Makalimu. Honorable members, in case you have forgotten your standing orders out of recess, you have 30 minutes within which you can make comments to this petition if you wish to. The screen is full as usual. I'm sure it was not because of this petition. And those who will want to make comments probably go to interventions. And if there is overwhelming interest, I'll give 3 minutes to each intervener.
Yeah, thank you, Honorable Speaker. So, Honorable Speaker, I was just saying that even as our committee looks at this petition, there are two fundamental issues they need to look at. One of them, Honorable Speaker, is the issue of a monitoring and evaluation framework. The reason why the petition is claiming that there is an underutilization of the scheme, obvious, is because nobody has been following up to find out what is happening. So that proposal of a monitoring and evaluation framework, Honorable Speaker, must be given a bit of attention as the committee looks at that. The other issue, Honorable Speaker, is the issue of public participation. Honorable Speaker, in a situation where we expect our students and parents to participate in this scheme, and then the whole issue of public participation not properly conducted, Honorable Speaker, then these gaps will always exist. So our Constitution has given us that provision that it is important there is public participation where involve our people. So I still want to insist, Honorable Speaker, it is important that as we undertake many of these activities, and more so, activities which are going to benefit the public, the issue of public participation must be taken very seriously, Honorable Speaker. Honorable Speaker, thank you very much. I submit.
The Honorable, is it Jared, is it Okello? You are not used to sitting where you're sitting.
I hear this is government side. I only hear. Well, I think... Yes, I'm feeling the warmth. I thank you, Honorable Speaker, for the opportunity. And I also acknowledge that from where you sit, Honorable Speaker, you are expected to be blind. But let me bring it to your attention that the target group of the EDA Afya Health Scheme, that target group has occupied the Speaker's chambers, or the Speaker's gallery, and they are here to listen very pensively to our contributions to this that goes directly to their welfare, Honorable Speaker.
They are also in the public gallery. Look back.
Yes, both the Speaker's gallery and the public gallery. Honorable Speaker, Article 43 of our Constitution pays great credence to access to health care. And the EDA health scheme, EDU was meant to address issues of health to the students who are in high schools or our secondary schools, Honorable Speaker. At this point, when digital platforms have percolated our systems and through globalization, digital is the direction that the world is going to, that the EDU still has inordinate delays and failures when it comes to addressing issues of health in our health facilities by students is something that needs to be properly looked into. The parents that take their children to school are already overstretched when it comes to family budgetary constraints. And if this scheme was meant to address issues of illnesses by students, and it goes and the students use this privilege to go into health facilities and cannot get the intended help, then there is basically a problem that needs to be properly addressed, Honorable Speaker. And I thank you for the opportunity.
Didymus.
Thank you, Mr. Speaker. I want to support this petition. This petition speaks to very weighty issues, Honorable Speaker, that any government program must be re-evaluated to be able to identify areas of improvement, because some of these policies are implemented, Honorable Speaker, without necessarily having the input of each and every person that will want to improve them. And developing a monitoring and evaluation tool, it's not only important, but very necessary, Honorable Speaker. The government can only improve, and we can only begin to change from situations where we just wake up in the morning and they want to scrap a program, or they want to suggest other issues to improve it without first necessarily scanning through the operationalization of the said policies, Honorable Speaker, so that we are in future, if we want to suggest further amendments, those amendments must be informed by the challenges, by the bottlenecks, by the need to improve efficiency, by the need to ensure that the target group is expanded, and those who are targeted are the ones who are benefiting, Honorable Speaker. So, Honorable Speaker, without much ado, this is a good petition, and I ask the committee to expedite the findings so that they can be implemented for the benefit of the country. I thank you.
Majority Leader.
Thank you, Honorable Speaker, and also rise to support this petition by Ms. Cherono. Honorable Speaker, I think the scheme as envisaged was to benefit our students, some of who are seated in the Speaker's gallery and the public gallery. And it's sad, Honorable Speaker, that if this scheme is not even, the system is not even able to identify kids or the students when they visit public hospitals. And Honorable Speaker, you know, we passed laws in this House with the amendment of the NHIF Act to even allow NHIF to have systems where they can use biometrics to identify patients when they attend hospitals. And the same, maybe the Committee on Health or whichever other committee will handle this matter, should ensure that students can be identified biometrically. We also made it compulsory for every Kenyan who, I think, who attains the age of 18 to be registered under NHIF. And the opportunity to be able to register students while they are still in school is the best opportunity to take their biometrics when they are still in school, so that even after school, they already enjoy and know the benefits of having a medical cover. And therefore, even after high school, on to university, and even in their working careers, they will have been socialized to the idea of medical insurance. Therefore, Honorable Speaker, I want to really beg the Committee on Health and Dr. Pukose to look at how they can deal with the technicalities, especially of biometric identification of students, ensuring also through the Ministry of Education, if the system of NEMIS captures students at the time they are sitting their KCPE, and even now with the CBC at grade 6, there is no reason why that same NEMIS cannot be integrated with the NHIF system, and they also take biometrics at NHIF, and use the two systems in an integrated manner, so that every student who is in a classroom, at least every school, Honorable Speaker, every other school, a teacher knows the number of students in the classroom, and they have a register that they call out every other morning. If they still do what we used to do when we were in school, we are being called out every morning. If that is happening, what is so difficult with the Ministry of Education getting the same data and ensuring every student who is in a school is also registered in NEMIS, and the biometrics also registered with NHIF? Thank you, Honorable Speaker, and I beg to support.
Dr. Nyikal.
Thank you, Mr. Speaker, for giving me this opportunity. Mr. Speaker, this is a very important scheme. And any scheme that is actually touching health, once established, should actually have a system of ensuring that every person who should get it gets it, and that it is monitored. But being in the Health Committee, we are going to look at it in a much broader in a much broader way, because it's the issue of scattering of all these schemes. You have this for the students, you have one for pregnant mothers, you have one for old people, you have one for people with disability. So I think we are going to look at it much more broadly and brought all these social protection activities and broader. Even if you look at school feeding programs, all these, they are all social protection. So we have to look at it, we support this, but we look at it in a much broader way. Thank you, Mr. Speaker.
Robert Bukose, and as Chair of Health, this is a matter which you need no prompting to follow up.
Thank you, Honorable Speaker, for both your guidance and allowing me to make my contribution. Honorable Speaker, I want to urge the Committee on Petitions that when they'll be looking into this matter, it will be important that they are able to invite the Minister of Health and the Minister of Health and also the NHIF to be, because right now NHIF and the Minister of Health, they are working on a product to consolidate all these schemes, the schemes on elderly, school children, the indigents, and everybody. You know, those school children, they belong to a family. And when they belong to a family, it will be good that some of those families could be indigents. So under that program, it is possible for them to be catered for. They should also be able to invite Dr. Ndi and his team so that they can shed some more light to them, so that whatever recommendations they bring to this House are recommendations that are well thought of, and if need be, if it requires some bit of amendment to the law, then we will be up to the task. My committee and my team will be up to the task to make sure that we provide the legal framework to which we can be able to operationalize these issues of provision of health care. Because when you look at our law, the provision of health care is a constitutional mandate, and it's not just health care, it's the best quality health care that the country can provide. Thank you, Honorable Speaker.
Thank you, Chairman. The Honorable Ferdinand Wanyonyi. Those who want to contribute go to interventions.
Thank you, Mr. Speaker. Mr. Speaker, I want to, on the very onset, to thank the petition. And she, I think, came up with a very good idea. But the problem is, apart from having the Ministry, the Committee of Health, we should also involve the Committee of Education, because I've had cases, Mr. Speaker, where even the teachers themselves don't know about this particular program. I've had cases where a student is sick and they rush to the Member of Parliament for assistance when this project is there. And at the same time, Mr. Speaker, out there, teachers are now saying, whoever, if a student is sick in secondary school, he goes to the nearest hospital where this program is actually operationalized. So I think apart from having the ministry, the commissioner dealing with this, we also have this committee of education, so that the teachers also are aware about this particular program, so that can be able to implement it. It's a very good program, given the hard times this country is facing. And I think I want to thank this lady for having come up with this petition. Thank you so much. I support.
David Gikaria.
Asante sana Mheshimiwa Spika. Mwanzo najua umesoma hoja petition. Sijajua utaielekezea wapi. Nimesikia chairman wa kamati ya afya akisema kwa vile najua hii inatakana kwenda kwa ile kamati ya public petitions. Na ninasikia na hapo pengine sisi kama wajumbe tuangalie, kwa sababu na nimesikia chairman wa hiyo kamati akisema wale waalike wale ambao wanahusika. So ni muhimu kwanza. Ya pili ni kubaliane na majority leader vile amesema ya kwamba ni muhimu tunaweza identify hawa watoto mapema kupitia ile mtandao ya kisasa ya biometric. Na nafikiria ni muhimu sana, kama vile mheshimiwa amesema, ya kwamba inahitaji wawe identified mapema wakiwa shuleni, na hata baada ya kutimiza miaka 18 wataendelea na ule, kama vile tulivyosema, tulipitisha mjadala ama sheria mwaka ile katika bunge ya 12, na tukasema mtoto yote ambaye anatimia miaka 18 ni lazima asajiliwe na ile fund ya National Hospital Insurance Fund. Pia nikubaliane na Bwana Didmas Barasa. Ni kweli Bwana Spika, ni muhimu mambo ya serikali ambayo tunaiweka kwa serikali inaweza kufanyiwa uchunguzi. Baada tukisha pengine tumefumbua kitu fulani, inafanyiwa uchunguzi, ndio tunaweza kujua uzuri wake, ubaya wake, kabla hatujaenda. Lakini nina support petition hiyo. Asante sana Bwana Spika.
Emmanuel Wangwe.
Thank you, Honorable Speaker. Honorable Speaker, allow me also to add my voice on this petition, and just want maybe, Honorable Speaker, to call on my colleagues whom we were together in last Parliament. There was a bill on the issue to do with the public participation, and this bill, this petition, Honorable Speaker, seems to question, seems to give us leads of question to how maybe the IDU came into existence in terms of the medical facility to our children in schools. Therefore, Honorable Speaker, my colleagues, it's our time. It's a wake-up call. The Honorable Speaker, we'll look at the qualification of the word public participation. If you may go to that bill by the Honorable Chris Wamalwa, we could be able, Honorable Speaker, to ascertain was there quality public participation, and it can only be done so, Honorable Speaker, if at all we are going to go back to that time when we can now validate the bill to do with public participation. Once we do that, Honorable Speaker, it will be now rather obvious that we will qualify in the manner in which some regulations, some rules, and kind of performance of various ministries and state departments can exist, Honorable Speaker. Honorable Speaker, it's also very true that our children, whenever they go to hospitals, I've had several cases in my constituency, Honorable Speaker, that some children can go to our local level 4 hospital and are not attended to just because the nature of the medical the identification, Honorable Speaker, is a challenge. Therefore, I support the bill, the petition, and wish, Honorable Speaker, to put it that that is a good petition which is going to help our children get a permanent solution on how they are attended to once they are unwell. Thank you, Honorable Speaker.
Oku Kaunya.
Thank you very much, Mr. Speaker, for this opportunity. I support that petition, which is a very important petition, on two major points. One, Mr. Speaker, sir, the question of public participation is key. On the second aspect, Mr. Speaker, the committee that will look at this, I would urge they should look at the overall NHIF performance. Mr. Speaker, this is the major body that does insurance undertaking as a public entity, and this should really be run efficiently. So therefore, some of these, Mr. Speaker, improvements that NHIF should bring on board should ensure not only this AFIA scheme, the EDU, for our students, but other schemes that are in operation are modernized and made more efficient and effective, especially with application of technology. Mr. Speaker, I support the petition.
The Honorable John Kitonga of Manyata.
Thank you, Honorable Speaker. I want to support this petition. The issue of NHIF and our kids, Honorable Speaker, we need to improve and ensure that it serves our people better. Honorable Speaker, NHIF is something that can help this country to really do a lot on our health care. I would like to say that we have had students who don't even know that if they're in high school, they're supposed to be treated for free in our public schools. And I think if there's a good database and they're given good data so that they go to those institutions, they can be able to be served right. I would also like to improve on it and say that NHIF should be able to serve us and ensure it serves even